Yolkisa Balchan Nazi Nezgando Topachina Willie.
33 responding code for a 6-year-old female not conscious, not breathing, possibly experiencing an allergic reaction.
The Nebach Ando Puppet Oni.
Mid 33 copied. We'll be responding code 3.
This student hit the net at India with Ariada Halne.
Mid 33 on scene at 2331.
Nihitene Betatanes Gado Kita Zagi Bahaya.
Mid 33 will be transporting. CPR in progress. B code 3.
Azedo Bena Al Kahidi Chadeyo.
Mid 33 Shiprock Air. Mid 33 Shiprock Air. We're transporting. Got a 6-year-old female on board. Possible allergic reaction from ingestion of peanuts. We're going to be about 5 minutes out. CPR is in progress. Yeah, we got Benadryl and FP going at this time. Any questions, orders?
Ben Yegi, Nigitient in Gitolzel. Nisha Stohat on the Neba Holiaro.
That's pretty cool. The Hero Twins are two brothers whose names are Monster Slayer and Born for Water, whose sole purpose was to protect the Navajo people. The story goes that they were sent on a journey to go meet their father, and along this journey they were protecting the Navajo people from monsters who were unaliving our people. And along this journey they were met by advisors such as Spider-Woman, who gave them tools and advice and prayers for their protection along their journey. Our logo, it's not the typical EMS logo, Star of Life, you would typically see on an ambulance. Ours actually incorporates our culture into it. The Navajo EMS symbol brings wholeness to both our culture and our EMS profession. There are several colors used within our logos, including blue, red, turquoise, flesh, black, and white. Each of these have their own meaning. The two figures you see in the middle of our patch are what we call the Navajo Hero Twins. These twins were born to protect our people against monsters. Therefore, when we use it in our patch, we kind of use it as Navajo EMS is symbolizing that protection to our people by providing our people with quality health care. We also have the 4 sacred mountains. The 4 sacred mountains represent the 4 directions: north, south, east, and west. Mount Blanca, which is located near Alamosa, Colorado, represents the east. San Francisco Peak, which is located in Flagstaff, Arizona, represents the west. Mount Taylor near Grants, New Mexico, represents the south. And Hesperus Mountain, which is located near Durango, Colorado, represents the north. You'll also notice the 2 rods, the 2 figures that you see in our patch are wrapped. And this kind of symbolizes protection and stabilization, which is very similar to how you would see a baby wrapped in a cradle board. The 3 lines, more of like a rainbow color, you'll see around our patch. Those represent protection and sovereignty. This shield, our patch was actually developed and designed by Kel Nez of Salt Lake City, Utah.
I become an EMT because I figured the community here needs more EMTs. I could do more by doing more medical field and accomplishing my goals and tasks by becoming an EMT and doing more further skills and more medical evaluations to do more further I would say patient assessments, to do patient care, and just understanding the way of life of how we treat life out there. It all started where I became Navajo Nation Fire and Rescue Service, and here in Window Rock, Arizona. I noticed that we worked along with Navajo Nation EMS, and I noticed that there was some few employees back then that that's still here, like Jemerson Minigoats. That was one of them that I really look up to, and he's been in EMT for so long, and I would say he was one of my mentors, and I really liked how back then Navajo Nation EMS really present themselves and how they responded to calls, and how, you know, they can do so much further of patient care while back up in the ambulance and on the route to the hospital. What I like about most being an EMT is providing patient care to my local patients. Being out there, responding, and knowing that I'm providing that initial care to that patient, it just brought me more care, more passion of what I love to do, is to initiate all my medical skills as much as I can beyond, I would say, be pretty much in my scope of practice, and just being there for my patient, talking to them, giving that comfort in the back of the ambulance, and just letting them know that as much as I can to provide patient care, that I'm there for them, and that I'm more than welcome to help any way I can, from the time I pick them up, the time, you know, I take them to the hospital, and then just transferring that patient care to a nurse. It just knows that, you know, they're still okay by then you were talking to them from there. Challenge is working as EMT is that I can't do paramedic level yet, but I do have special skills of doing like IVs on site, and giving the NS fluids, basically normal saline fluids, doing a 12 lead, but just letting the nurse know that I did initiate a 12 lead on basic EKG level. So I just want to do more further. I like to accomplish more skills, and that's the hardest part. It's just, you just do basic skills. Yeah. I manage my stress level by reading books and spending more time with my family, and, you know, traveling, hiking, swimming. My family really support my career field in the EMS. They really love to see how I go in the ambulance or respond calls late night or in the early morning, because they have that full understanding of me as an EMT to respond whenever I'm called upon. My future plans as an EMT is that I want to pursue my career in paramedicine. I have been accepted through Northland Pioneer College Sholo for paramedic class.
The Navajo Reservation, it covers 4 states, Arizona and New Mexico, Utah, Colorado. There is about 400,000 Navajos enrolled, and I believe 150 to 200,000 that live on the Navajo Reservation. Our response times, it can take 45 minutes to an hour, sometimes a little longer. It depends on the area. We could go 15, 20 miles off-road, so that could take a while, or there has been certain times where we respond to a home where the med unit is not able to make it, whether the road is too bad or it's muddy, or, you know, just the area is bad. So we would have to call rescue out to help us. So sometimes the response time can take a while. So at times we do encourage family, if they can, bring them out or meet us, just so we can get their family member to the hospital a lot faster. That really helps. Sometimes the weather could be a factor, where it's raining or it's snowing or it's muddy, so that it can take a little longer. We do try to run 2 to 3 med units at a time, and there are times where all the med units are all busy. They're responding to different emergencies, but as soon as one is done, they'll respond to the next one. So it varies, and we do try to keep in contact with the patient if they're able to transport in, or we'll let them know, hey, we're on our way now. So it varies at times. On my days off of work, I always try to relax, but it usually doesn't happen. I foster dogs, so I'll be out walking my dogs or helping community members with their dogs, whether that's helping with dog food or getting them signed up for spay and neuter, just anything along with the overpopulation of the stray dogs, I try to help. I also help my husband. He has a woodworking business. He also has a full-time job on the side. He does a woodworking business, so I help with that. But if I can get my dogs out, we'll go out to the mesa, go walking, get them out, stretch their legs. But that's usually about it. It's just try to relax, try to have some downtime, and usually just helping with the dogs and the community members it's helpful to me. The Navajo Nation has tribal parks, national parks. Here in Chinle, they do have Canyon de Chelly, and about an hour away in Maminit Valley, they have that park there. And I know of those parks you can go tour in the park area. The Navajo culture, the Navajo people, they look out for each other, their family, whether it's blood related or clan-wise. Not everyone, but everyone kind of seems like they're related by clan. So they'll address each other by that, like you're my brother by clan, you're my Nolly, you're my grandma. So they take care of each other like that. They help each other, simple stuff as bringing food, giving them rides. They look out for one another, they look out for their neighbors. And I think with the Navajo people, that's a big thing. When a family is invited, it's not just like you and your kids. It's like you invite grandma and uncle and cousin, because it's a family thing. And Navajo people have a lot of family events. They celebrate everything, whether it's the first birthday, the first laugh, it's always a family function. So since I lived in the very middle part of the reservation, we don't have very much access to much stores. So we do have to go to town, which is about a couple hours away. So usually on my first day off, we have to set aside a day just to go to town, grab our food, household necessities, or even just to sit down at a nice restaurant or watch a movie, just, something where it's just us with the family.
So what it is to work with Navajo Nation EMS, it's actually a very great opportunity. I think that there is a lot to explore, as in the way of getting your experience and interacting with the community on different levels. I think with Navajo EMS, we are different in the aspect that we have a lot of area to cover, and we don't cover just one specific area. We cover the entirety of the Navajo Nation, which is pretty huge. And I think it's very interesting that we all have very unique geographic locations, and we all deal with different challenges that come our way. And we are able to adapt and overcome with a lot of that. The other great thing is we actually get to practice our medicine instead of people who are in a metro area. They are to a hospital in 15 minutes maybe. We're able to actually see if we give glucose, for example, for a diabetic who is having a low blood sugar. We actually get to see those improvements happen right in front of us, or even for someone who has a seizure call. So it is, I think, great that we actually get to see the effects of our medicine in play. Some of the unique challenges I think that we have here on the Navajo Nation specifically is we don't have great road systems. Coordinates is always kind of a hassle to get to because a lot of people don't understand what we mean when we're asking for GPS coordinates. And so I think the more education that we can put out there and understanding what we're asking for and how to obtain those coordinates is a great way to interact with our community. The other thing is we don't have paved roads or anything else like that. And we also don't have reliable cell phone service. So sometimes that can cause a challenge, especially when we do have a critical patient who needs to be possibly flown out via helicopter. And so sometimes those can pose quite a bit of a challenge to us. I know a lot of areas, they like to say, oh, I'm by so-and-so's residence. We don't go by resident names. So I think it's important to start understanding that. And I think the more accurate you are with the description of your house, especially if you're located off a major highway, like say, for instance, we have Highway 491 here in the Shiprock area. If you are located somewhere near milepost 80, it's great to say if you're north or south of that highway, and then approximately how far that distance is away from the road. And then also, again, trying to be as specific as possible as to which direction your house is located in. And then if you can give us a house description along with vehicle descriptions or anything else like that, that's always great. And it's always very useful information for us to have. That is definitely one of the challenges that I face as a provider, because unfortunately I am not fluent in Navajo. So sometimes I have to get creative, especially when it comes to when I think someone may be in pain. I have to break out the Wong Baker face scale and kind of point. Sometimes they understand what I'm getting at because most of the times they've seen it in the clinic. So if I can reference to something that they may understand or have used before, I try to do that. If I happen to have a partner who is fluent in Navajo speaking, they are usually really helpful with me on scene and trying to get the information that I need obtained. And I know my partner can't always be in the back with me, so I try to get all the useful information I can while I have my partner with me in the back before we actually start transporting. When it comes to scene safety here on the Navajo Nation, we're in a very unique situation because we don't always have PD available to come help us, and we don't always have a fire department that's able and willing to respond with us because we're also very short-staffed. Part of the other issues with scene safety is we understand, families are very anxious. They want their loved ones to get help and stuff like that. But I think when you also have multiple family members that come and surround the two providers that are responding, it can be overwhelming for us because we also don't know what we're going into. And I feel like that is just something that we need to be a little bit more cognizant. And calls can always churn at any time too, and that's also part of the unpredictability of being an EMS. So I actually do plan to be with Navajo EMS quite a bit longer. I actually would love to keep expanding and maintaining my different certifications that I get. I'm really big into teaching. I think that is one of the things that we could do greatly with. We can go far with teaching others, especially because we're in a unique setting for all of our field offices. I think if we can have people that are willing to teach, we are willing to keep those people that enter into this field, and we're able to keep them up to date with the current knowledge and stuff like that. And we can also build a program that is unique and would help suffice all the trainings that we would have here, because I know different field offices run into different problems, and also some field offices don't always have higher level care. I know we're very unique in the area that we have quite a few ILS and ALS providers, and we're very fortunate to have that. But we also realize too, not every office does have that. When I interact with my coworkers or my colleagues in the different offices on the reservation, it's always unique because I always get to meet new people that I wasn't always aware of before. I don't always get the opportunity to go out to the different field offices, so when I get that chance, I try to take advantage of it. And I think it's always interesting to learn what your colleagues face in their areas and kind of seeing how they've adapted to those challenges that come from those situations and everything else like that. I think for the most part, we're all very accommodating, and I think we're usually pretty happy to see other people from other field offices as well. Okay, so some of the big changes that I have seen and some of the greatest improvements is we were able to establish our own image trend through Navajo Nation, and that's been a big applause for us because that is a system that we definitely needed because we were kind of under the state's direction with that. So having this in place for us is great because it really solidifies and we can pull data points for our areas specifically and for the different areas that we serve. So I think that's one of the greatest things. The other great thing is we've really expanded on buying new equipment. So new ambulances, we've been able to get new Zoll monitors, which has been new to us since COVID, because before that we were dealing with the LifePak monitors. Our paramedics are able to have glide scopes. That's a huge bonus for us, because that definitely helps us when we have challenging airways to make sure that we're being successful more so on the first pass. There's quite a few changes that have happened, and I'm happy to say like that's been a big part and due to our department manager, Chris Cascoli. I think he's done great trying to steer us to push forward, and I'm excited to see where we go forward from here. So I think Navajo EMS has definitely impacted my career in the fact that I understand what it is to be a rural or like a frontier provider. I never understood like those terms necessarily because like we hear them and we hear about like people that don't understand like some of the other demographics or challenges that other EMS agencies have to deal with. But working in this area specifically, I definitely see that it's challenging to say the least, but it's also one of the most rewarding jobs that I've had. It's definitely something when you know that your community is in need of help or when they're in need of services, that you can be somebody who has been advocating, who has done the best to make sure that they are getting the top care that they should have access to at all times. It's also given me a lot to be thankful for because we're able to be there with patients and their families on the worst day possible, and to be put into that situation is actually a feeling that I think a lot of us don't always recognize right away, but that's a very powerful situation to be in. And I think it's great that we can be advocates for our patients and their families and making sure that they try and get the best care possible, not only from us, but following through from the hospital to whatever definitive care that they land at. Sometimes people just need someone to hold their hand and, let them know that, we're trying our best to take care of them or their loved one. I know some of us have been in those situations, and I think at the end of the day, having that impact through empathy is one of the best tools that we have in our arsenal.